as you know, because you participated, and most of our audience knows, the McKenna Academy organized this conference last May in the UK called ESPD 55, which stands for Ethno-Pharmacologic Search for Psychoactive Drugs. And the 55 is that it was the 55th anniversary of the original conference, which was held in San Francisco in 1967. That was a private conference. The only thing that ever came out of it was a publication, a volume by the same name. And somehow or other, I got my hands on that volume at the age of 18. And it really opened my eyes to the fact that ethno-pharmacology was a real discipline. There was actual science involved. And many of the leading investigators at the time, I mean, there weren't that many, but people like Ari Schultes and Alexander Shulgin and Andrew Weil were actually at that conference. And I knew of them because I was deeply into the literature at the time about psychedelics. So I always had an ambition to do a commemorative version of the ESPD conference, but make it open to the public. So in 2017, I was able to do that, and we did ESPD 50 at another location in the UK, and actually published the original symposium plus the 2017 symposium as a box set that Synergetic Press brought out. That's still available. You can still order it. But 5 years on, there's been a lot of developments in ethno-pharmacology, so we decided to do ESPD 55. And what also happened in the meantime was in 2017, there was no McKenna Academy other than in aspiration, but now there is. So that happened under the ESPD 55 happened under the auspices of the McKenna Academy. And you came, and many investigators, the whole idea of the ESPD is to look at the little known, lesser known traditional practices using psychoactive drugs that are either not well investigated or certainly not well investigated by science. And your presentation, both yours, John, and Shauheen's, were, fit the model exactly, because you brought new information about very poorly understood traditions of psychoactive drug use. And when you're talking about those topics, you're also talking about plants that are less known and pharmacologies, often chemistries, that are less well understood. And that's the whole idea, to bring these areas of investigation in what you might call psychoethnopharmacology out of the shadows and shine the light of science on them. And you guys have done a wonderful work around the Beta-Carbolines, which everyone knows about Beta-Carbolines because of their association with ayahuasca. What most people don't know is that in their own right, they're an interesting class of psychoactive compounds. And other than their use in ayahuasca, they don't have much use in Latin American New World ethnomedicine, but in the Middle East, they have a very important role as potentially the source of Haoma. Mm-hmm. And that's where you come in. So this is your expertise, not mine. But I'm really fascinated. I'm really happy that we were able to invite you and present this material and focus on this really very promising set of compounds. The Beta-Carbolines, as you already know, are structurally very diverse and represent a variety of different pharmacologies, far beyond simply monoamine oxidase inhibitors, as it turns out. So So you've pioneered this, and you've built your company around with a focus on these compounds, among other things, I assume. But it's good that that's a central focus of what VCENNA is all about. So tell me a bit about the company and what led you into this.
Absolutely. First of all, it was our pleasure, and you were our inspiration, mostly when it comes to beta-carbolines, just reading your work from back in the day. And then the whole movement around the psychedelic renaissance that's happening in the past 5 years. It was an intersection. It was a very interesting intersection. And specifically, John and I's Eastern background and this kind of cavity and gap that we saw that exists in this space, that was the main inspiration for just submitting those proposals. And we were very lucky that they were accepted, and then we were exposed with this knowledge to be shared and distributed. So VCENNA started in 2019 with the focus of extraction of different alkaloids from plants. The extraction technology was what we started with, but when 2020, the psychedelic industry started to heat up, we moved toward other alkaloids and extraction, and then from there into basically exploring what was some of these plants that are coming from the East that are less studied in the West, and getting into their pharmacology and drug discovery. So that is where we started from, and basically last year, that was the time that we put most of our effort in terms of identifying some of the compounds that are on the top of them. There are beta-carbolines that, as you said, their beta-carbolines are very well known in the context of ayahuasca, and mostly as an MAOI or monoamine oxidase inhibitors, but not further than that. And with some of the diggings that John and I have done in the basically the Ethno-Pharmacology of the Iran region and China and those kind of Middle East and West Asia or East Asia, we just saw these traces of how these compounds were used by our ancestors and for different purposes, which at the end of the day, it was just around human transcendence, and exploring more of the consciousness. So this was a little bit about how we started with, but VCENNA is a drug discovery company. As we said, last year, we were trying to mostly push toward becoming a a drug development, pharmaceutical company. But we are going to share a little bit more about this story, but half in the way we decided that, it's better to see what we can bring into market immediately, which the beta-carbolines, because they're fully non-scheduled in the US, was on top of our list. So with that, we launched a line of nootropic supplements called Magi, or Magi Ancestral supplements, that are coming from the Eastern plants. These formulations are inspired by the wisdom of the Magi, who were the Zoroastrian priests of ancient Iran. And this was their legacy in use of psychoactive and hallucinogenic, plants to access, higher state of consciousness and mental wellness, which is very interesting. Mostly in pursuit of the enlightenment and a concept called the good mind or Haoma, which I can talk more about that.
And when you're okay.
Yeah, Shauheen, for obviously, I think I must interject with the one word that everyone probably knows from that, which is the Magi. Who were the Magi? And since we just celebrated Christmas of these three wise men, maybe we want to talk a little bit more about their gift of psychoactive plants for the birth of Jesus, which is what they're mostly known for.
Yes, yeah. I'd like to hear more about that. Of course, everyone knows about the Magi and the whole myth of the Magi. In fact, a few days ago was in the Christian calendar, the Feast of the Epiphany, which in the Middle East, in Eastern Orthodox and so on, that is Christmas. And as you know, I'm not telling you anything you don't know, but our audience may not know, but the Feast of the Epiphany supposedly was when the Magi got to Bethlehem and they brought their gifts to the baby Jesus. And that was the actual Christmas. You know, I hope I'm not misrepresenting that. And you're saying that the gifts that they brought, I thought it was gold and rubies and that kind of thing. It was psychoactive plants, medicines, you're telling me?
Well, there was gold, but so 33% was something of monetary value. The other 66% was what we know, frankincense and myrrh.
Frankincense and myrrh, right. And
Yeah.
when you're
Well, the word Magi, it's like the Greek referral to this wise men, that it's kind of like these were the story doesn't say that like where the Magi came from, to find the nativity of the baby Jesus, but so basically they come from east. That the word Magi is actually come from Magi, which is the plural form of magus or mulk in Farsi, which is basically these are the Zoroastrian priests of ancient Iran. And they had they were kind of counted as wise men, but by the Greek, they were known as Magi because they had this supernatural power of, let's say, receiving knowledge from astrology, and that was how they basically found the nativity. And somehow they were also referred to by Greek as sorcerers. So that's where the word magic come from. So magic is part of Magi.
That's what I thought. The magic comes from the root of Magi. And the Magi were Zoroastrian priests, right? But they were also sorcerers, you say? Or would it be accurate to say that they were kind of shaman? I mean, do they hit that sort of archetype? They were people knowledgeable about the use of medicines and plants, particularly psychoactive plants, and they were effectively doctors as well as priests, or is that inaccurate?
Yeah, so basically before Zoroaster, the pre-Zoroastrian religions in Iran, they were dominated by communities of ecstatic priests and warriors. So basically shamanic practices and accessing to this ecstatic trance state was as a part of the practices that they had. So this is what I've read is just being known as sorcerers was the referral of Greek into the knowledge of the Magi, not necessarily that they were kind of always trying to stay from sorcery or witchcraft, as basically the distinction is that the Magi were the righteous people, and that's where the distinction happens, that the witchcraft is separate from the art of accessing this ecstatic states.
Right.
So they perform these shamanic ecstasies and otherworldly journeys to encounter deities and to receive reassurance about the truth of their faith. So that's where the source of these practices come from.
I see. So on the ethno-pharmacology side of this picture, as you know, in South America, the Beta-Carbolines are potentiators of other plants that contain DMT, which is not orally active in the absence of those Beta-Carbolines, of those MA inhibitors. Is there any similar pharmacology in these Zoroastrian medicines? Any reason to think that they may have utilized plants containing DMT in combination with these Beta-Carbolines? I know this is probably a loaded question, but I have to ask it.
Well, nobody knows what was the real combination, right? But it's just that the only way to understand some of those is, the definition of some of these subjective states that they experienced. And what I can conclude from most of our research is that there were not just one simple plant or just like a simple, botanical identity. Most of them, there were mixtures, and there were mixture for different, rituals. And so there was a big complexity, and they knew exactly like what they were mixing with each other, what was the dose, or what kind of, ritual. But specifically about Haoma, or home in Farsi, like home is today referred to a plant called ephedra in Iran, which ephedra is widely spread in the flora of like northeast Iran, as well as like China and those regions. And that is the plant that Zoroastrians of today are taking as home, which is the home or Soma or Haoma. The word means to press out. Basically, it was an extract. So they were just like using the pestle and mortar to get these active compounds out of these plants or the plant mixtures. And that was how basically the Haoma, and they were also, it was just, they were drinking it and they were also burning it. So there were two kinds of like, it was also used as an incense. But back to like what it was and a comparison with ayahuasca, specifically around beta-carbolines, I should say that there has been a like very long research about the botanical identity of Haoma or Soma, which, as you know, like Gordon Wasson, has a book about Soma specifically, that he believes that Soma is the Amanita muscaria or fly agaric mushroom.
Right. But you don't buy that. Haoma was the real Soma. And it was more ancient than Soma, right? I mean, it came.
Soma is more ancient because basically the text from or like Rig Veda are older than the text from Avesta. So the text are these are basically poems that they were just like reciting for over 1,000 years. And actually, David Flattery believes that because Avesta or Gatha was transcribed about 1,000 years later than Rig Veda, so this basically the referrals to Haoma are more accurate because it was transcribed about 1,000 years later than what is available in Rig Veda. So based on so I can tell you that maybe the botanical identity of Soma and Haoma could be very different because the flora of India and Iran was different. And based on that, specifically the work of Haoma and harmaline by David Flattery and Martin Schwartz from 1989 is a paramount work in terms of like the fact that they separated these two and they looked into Haoma very separately from the context of Soma. So David Flattery believes that basically Homa's main intoxicant or hallucinogenic intoxicant was Pegonum parmala or espand. So that is where most of our research comes from, because espand is a very rich source of beta-carbolines, specifically harmine and harmaline. And if you can compare it with the plant Yahe or Banisteriopsis copy in ayahuasca wine, which is a higher source of harmine and tetrahydroharmine, as your pioneering work, referred to it back in 70s. So yeah, that's where kind of like our business with the study of beta-carbolines have become, more and more deep in this respect.
Mm-hmm. Okay, so you're building on this traditional knowledge, but you're bringing the latest, most advanced tools of neuropharmacology to this, neuroscience, drug discovery, receptor science, and all that. I mean, when you claim that Haoma is a hallucinogen, the beta-carbolines are not hallucinogenic in the way that say psilocybin or DMT is. They're certainly not classical hallucinogens. Can you make the case that they are hallucinogenic, or is that even hallucinogen itself is a misnomer. We don't like to use the word hallucinogen because it's inaccurate. Most of the classical, hallucinogens don't cause hallucinations reliably anyway, if that's the criterion. That's why I think the word psychedelic is coming back into the nomenclature. And psychedelics is a much broader term, but maybe it's vaguer, but maybe more accurate because it means mind manifesting. And the beta-carbolines certainly could fall into that category. They do manifest the mind like these other things do, but not in the way that the tryptamines do, for example. So can you talk a little bit about the phenomenology and the subjective effects and to the degree that laymen can understand it, what are the subjective effects of these 3 different or 4 different supplements you've developed, and what's the basis of that? What's the pharmacology behind that? Of course, we're not talking to pharmacologists or neuroscientists. We're talking to ordinary people like me, or even perhaps less familiar with pharmacology. But can you explain a little bit about what the pharmacology is behind this beta-carboline chemistry?
Absolutely. I'll leave that to John, but before that, I want to just make a distinction about how beta-carbolines subjective effects are, and I guess whoever has taken ayahuasca can probably relate to that. So they are by themselves counted as oneirophonic, or the compounds that they are kind of inducing a dreamy state or a dreamlike state. Basically, this is a state that has been referred to in most of the Zoroastrian texts for when the Zoroaster received his revelation, or, some of the other member of Magi, that they had this several days, of dreaming, that they basically had access to the realm of, after death, or to the realm of, collective unconscious, as Jung, posits this. And so this dreamy state, or we call it this mindlessness, that you are in this numbness, but in this kind of dreamy state, you are exposed to a leap through your consciousness. So you get to receive something, from, the unknown, from the unconscious immediately, and you get to know that, in basically in no time. So this is the effect that is related to the effect of beta-carbolines. And from my own experience with ayahuasca, I think that's exactly where this, the realm of dream marries, this high entropic, flush of thoughts that you get under the tryptamines. And that's how experiences like ayahuasca experience is bringing, epiphanies or breakthroughs, for people who are drinking these in a right setting. But I'll leave that, to John to talk more about some of our inspirations, for bringing those effects into Magi.
Okay, so in some sense, you could characterize these beta-carboline formulations as oneirogens. You're familiar with that word, right? Something that brings on dreams or stimulates dreams. Maybe that's a more accurate term to apply to these kinds of medicines. But John, let me hear from you. You're the pharmacologist of the team. What can you tell us?
The interesting thing behind this here is not just what did the actual dream-like experience provide for you, but particularly if you look back to so much of Eastern medicine, and particularly traditional Chinese medicine, it was never one compound. This is why something like ayahuasca is always near and dear to my heart. It's a mixture of these plants, oftentimes plants from very disparate regions, that through a long series of experimentation, humans discovered that they are very active together. And certainly Chinese medicine was very much this way here, where very rarely would you find just a single plant or a single compound. This whole, one target, one receptor, one drug approach certainly never existed back then. Theirs was always going to be a mixture of different compounds. And In some ways, I'm a little disappointed actually to discover that there was not a history of beta-carboline or espan use in traditional China. In the Xinjiang and Siberian provinces to the west, the plants does grow, and only in the last couple hundred years was there medicinal uses that go as far as things like as pesticides, as well as a variety of kind of like a panacea of different health remedies that it was used for. But when I look back at some of the oldest Taoist texts, what they were seeking was exactly the same as what the Magi were, which was this pursuit of transcendence and this pursuit of inner spirituality, what they would call something more like an inner alchemy. And they used a lot of different, here's where it's interesting where words matter. What we would not call hallucinogens or psychedelics in China, but the specific word that we would use is translated to mind altering, which I think is very appropriate. And given the effects here, I had this deep hope that I would find the use in some of these old texts of Espan or Paganum harmala, but fortunately, there's many other plants and some that we've experimented with and done some combinations with. But the objective was always to reach this transcendence, which the state of dreaming while you're awake, which often you can even look at as attainable through meditation, is exactly that.
And this was a goal of Taoist alchemy as well, right?
Absolutely.
And when you're that's very interesting. So you think that the Taoists were onto some of these formulations, which may have included beta-carbolines, but the plants are not known. Is that basically what you can say? Or have you, I guess more specifically, have you stumbled on any plants in the Chinese Pharmacopoeia that might point to this, that we know from modern day studies might have had the right alkaloids or the right constituents?
Yeah, only from the really recent, and recent, of course, in the span of Chinese history would be older than the United States, past 300 years or so. But given a 5,000 to 6,000 year history of Chinese medicine, there was not a longer use going back towards the time that Chinese medicine really started to take off, which was around 200 BC.
Right.
Yeah, most of their compounds were much more focused upon more the tropane classes, what we would call something like a deliriant, which certainly are psychedelic.
And when you're right, and there are certainly elements of Chinese medicine that point toward mushrooms. And mushrooms apparently were held in high esteem. Like the Ling Qi, I think Ling Zi,
Ling Zi,
Derma, but not psychoactive mushrooms. But they may have been, they may have also, in fact, they must have known about psychoactive mushrooms. But I guess it's not in the pharmacopoeia, which is kind of interesting, kind of puzzling, actually.
Well, there are psychedelic mushrooms that are in the pharmacopoeia, specifically the psilocybe, the azurin strains, the cyanescin strains, were both, those grow very, very rapidly across eastern China, and those were known to be used. Given how some of the mushrooms, like the lingzi, or which is like a reishi mushroom, gets a lot of press. We know that that's one that was used very, very rapidly. Whereas something like the psilocybe containing strains, they were used, but they weren't with the nearly as prolific as some of these non-psychedelic mushrooms. Naturally, it also becomes difficult to really translate when you look at just how illustrative some of the descriptions of their trip reports are.
Right.
You're going to see spirits flying above the clouds, riding on top of dragons, and that's describing nothing except for just like a turkey tail mushroom.
Right. So this use of the psilocybes in China, this is documented. This is known.
Yeah. There's in a couple of the different materia medicas. This is known going back to about I think 700 or 800 years.
And when that's very interesting. I mean that also ties into this, this puzzling contemporary phenomenon, which the other gentlemen, Colin Damnauer and Brian Ellinger,
Bryn, yeah.
Bryn, yeah.
they talked about the psychoactive boletes or the putatively psychoactive boletes, but it seems it doesn't, from the description, sound like psilocybin. And apparently the chemistry is very elusive. They're not reliably psychoactive, but you have these interesting trip reports, about seeing the little people and that kind of thing, which is very interesting when you think about it, because the Yanomami Indians and other groups that use the hallucinogenic DMT-based snuffs in South America also have a whole mythology about how when you take the stuff, you see the little people, and there's a great deal of parallels to their reports from China. Anyway, I know we're off on a tangent here. We're not supposed to talk about Chinese medicine, but so tell us what you'd like to about the pharmacology and chemistry of your formulations or of these beta-carbolines.
Yeah, so back to the beta-carbolines themselves, I mean, as we've long discussed, they've widely been known for their MAOI properties and believe that was the only effect that they had. But when you do take them by themselves, just having an MAOI property would not result in having this onophoronic dream-like state where you can have a level of dream access while you're awake, which is certainly beneficial because the biggest challenge of dreams is you often just don't remember them.
Yeah.
If you can experience them while you're awake, you can start to capture a deeper level of some of the emotional insights that your psychology is trying to unravel while you're in this dreamlike state. And as we went through the deeper psychological, the deeper receptor profile for what exactly do these compounds do, the one that really stood up to us, which is our theory for where most of the impact comes from, is the receptor that's known as the imidazoline receptor.
Imidazoline receptor. Okay. Tell us about that.
It's a highly understudied receptor.
But tell me, okay, why is that important?
Yeah, it's a highly understudied receptor that deserves much more credit, and for a long time was thought to be just another type of one of the adrenergic receptors. Its structure is very interesting, and particularly the imidazoline 2 receptor is one that has been implicated in pain perception. So it has been studied for its analgesic properties. But pain, of course, then has its corollary that is related to the overall perception of consciousness and feeling. The thing that's most unique about the beta-carbolines is they are the strongest known agonist to the imidazoline receptor. Nothing synthetic that's been created has been able to approach the level of selectivity nor the high level of binding, particularly to the I2R receptor. So it's our belief here, based upon some of the different studies with blockers, that this is the one that's particularly implicated in the dreamlike state.
That's very interesting. So imidazoline is a neurotransmitter, or?
Yeah, it is primarily found actually in the intestinal system, since we think with much more than our brains. But that's the greatest prevalence, I think, is in the small intestine.
And when you're okay, and it's involved with analgesia and pain perception, as well as possibly dream processing and that sort of thing. How come this thing has not received more attention? It sounds like a fascinating novel target for beta-carbolines and possibly other compounds that might be developed from beta-carbolines. I mean, this is huge. How come nobody's paying attention to it, other than VCENNA, of course? But
yeah, there have been a few groups behind this, and here's where I'll have put on perhaps my cynical hat for my also theory behind why I believe that is for a lot of the good research that has come out of a number of academic institutions behind this. For I want to say a period of about 10 or 20 years, there was a fairly intense level of study to try and create a synthetic compound that would be an agonist of the imidazoline receptors. And I think the key reason behind it is because so much of modern pharmaceuticals is based upon developing not necessarily the best drug for treating the human body or brain, but the best drug for intellectual property.
Yes, exactly. You've got to be able to patent. But these beta-carbolines, apparently they are good agonists for the imidazoline receptor.
Yeah, the strongest.
And what are the beta-carbolines that are best at this? The classical ones, harmaline, or more obscure, structurally different ones?
Yeah, harmine specifically is still the strongest one. So out of all the synthetics that are out there, so I think like reserpine does have some level of affinity for it. A couple of the other ones that are still under some actually even clinical study have affinity, but nothing is actually proven to be stronger than just harmine itself.
I think harmaline has a stronger affinity to imidazoline receptor 2, John, no?
And when you're
yeah, I can't remember. I thought it was harmine was the strongest. Harmaline was even less so.
Harmaline is actually strongest. And there's some work, Dennis, that from some researchers who have been working on imidazoline, that they inject imidazoline for acetic acid, to rodents, and the result was this hypnotic, basically effect that is exactly like a hypnotic state resembling sleep, that was followed by some type of seizure type activity in rodents. So this is also something that, again, kind of is in congruence with, with the effect that we think, imidazoline 2 receptors has. But the most interesting work actually comes from the work of Claudio Naranjo back in 1964. He has this book called The Healing Journey. And for those who don't know Claudio Naranjo, he was a psychotherapist, and psychiatrist, a Chilean psychiatrist who was running this clinical trial that, basically he was receiving referrals from the patients with major depressive disorders that there were no other intervention had worked on those. So what he did was that he injected a intravenous dose of 10-methoxyharmaline into these these patients, and it was, I guess, only some of them there were twice, but most of them there was only one experience. And this chapter of this book is called the Harmaline and Collective Unconscious. It's a very interesting chapter. It's a trip reports of 3 of these patients, and the conclusion is very interesting. Most of the subjective effect is around a physical, relaxation, a tendency to withdraw from the environment, a feeling of a certain numbness that opens you to extremities, and a very visual, actually, image. It's exactly like hallucination and imagery hallucination that they got under this dreamy state. So this is kind of like the most relevant work about the injection of a harmaline compound into, basically intravenously, which acts very quickly, and then the relation of that into, basically something which is more like an interpersonal experience, which is more like a Jungian archetypes, because most of these, exactly like ayahuasca, like most of these patients saw images of, let's say, people that they had never met before, like Indians or like birds or like, let's say, dark-skinned men, death, or circular, kind of imagery around the unity or oneness. And this was kind of common in the experience of most of his patients. So that is how Naranjo actually relates this experience or this dreamlike state that you kind of consciously meet the age of unconscious. And this is not the personal unconscious, this is the collective unconscious that you have been inherited, not necessarily acquired, or it's not part of your conscious that's been repressed. And I kind of like that kind of aligns very well with the Jungian theory of different archetypes that he posits that way.
And when you're that's absolutely fascinating. Of course, I was aware of a bit of Naranjo's work because he actually, interestingly enough, in this connection, he was one of the presenters at ESPD, the original ESPD,
the original
1967. He had a chapter on exactly this topic. And, I have to re-look at, I may have to eat some crow here because I had kind of dismissed it, this report, because it was a report of the patient's reaction. And my response, my sort of original take was, this is not a controlled experiment. You're going to give people compounds and tell them that it comes from this jungle vine, and the whole context of that. And of course, they're going to see jaguars and snakes and that sort of thing, even though they're urban, residents of Santiago, Chile, and probably never got near the jungle. But maybe I was not too fair with him. I mean, he certainly was a pioneer. That's really very interesting. And when so, do you think that, right now, the whole psychotherapeutic community is excited about psychedelics, and talking about the new therapeutic paradigms for depression and PTSD and all of these things, addictions and so on. The big problem that a lot of these companies are facing is they'd love to be able to use psilocybin, but they can't. It's still illegal. I mean, you can only use it in clinical trials. Eventually, it may be legalized for clinical use. So a lot of these, and when you're therapists, for lack of a better medicine, have turned to ketamine. But maybe under the right circumstances, these beta-carbolines, these imidazoline agonists, could they potentially be used psychotherapeutically? And have you done any trials in that respect? And or do you plan to? What's the status of that? It seems like if you could bring a medicine, forward, it's not prohibited, it's not scheduled, so you're not crossing any legal barriers. And potentially, if it has a therapeutic effect, you've got, then you have tremendous, patient base that would be interested in this. What are you doing? Are you pursuing this?
Yeah, the maybe the funny part about like some of these pharmacological intervention that exists in nature is that like they don't receive that much interest from the medical community, because as we said, like because they can't be, these are natural compounds, they can be patented, and specifically like investors, they want to protect their capital, and that's where maybe something like this that could have a high potential, specifically with the work of Naranjo. Let's say, I'm sure like there might be other researchers that they're currently working on these that are not even published, but yeah, this could be something that specifically knowing the process and the mechanism of action and how in what subjective state of mind, let's say the psychotherapy could be present to help these patients. That could be a very plausible therapeutic solution. I guess for the listeners of this podcast, I refer them to read the chapter of harmaline and collective unconscious from The Healing Journey by Claudio Naranjo, which he actually has elaborated the experience of three of these patients. But back to what you said about let's say comparison of psilocybin, specifically now that it has received a lot of attention in BOS versus beta-carbolines. I think the subjective effect of psilocybin is definitely more interesting, in terms of let's say the psychedelic effect, like around the flush of, just high entropic thoughts, that allows you to look into things, from different aspects. Let's say when you have this interconnectedness of, let's say, different part of your memory. So those are very new experiences versus the beta-carboline experience is more like, any type of lucid dreaming that you may have at one night. It's just like you are not consciously going toward that. But let's say if you have a pharmacological solution for that, that you invoke this, or you inspire this state that, let's say, you are consciously present at the edge of, just connecting to the unknown, to the unconscious. And then you have to, at the same time, you have to psychologically be in a position that you can, process that, not go crazy, but by just, being exposed to more unknown in your life. I guess that's where, mostly the work of psychotherapy comes, and maybe the screening for psychotherapy comes. But definitely, we believe that beta-carbolines are overlooked and they have a very high potential. And that's why we started to bring into market this supplements of basically just with the main compounds of beta-carbolines around this, again, this kind of practice of mindfulness, or where you consciously want to, again, like learn and receive from the unknown about yourself. Just kind of like bringing, as Jung actually puts the individuation, concept around like how you move from your ego toward yourself. Like these are some practices that you can just define yourself in the bigger context of the universe. So these compounds under Magi are formulated to help with that. John, do you want to maybe address a little bit about like what they do? And
yeah, a little bit of what they do. And I think one portion that we also want to talk a little bit about is how do we come up exactly with our formulations? And this comes to our heritage of beginning in the drug development field, which originally working with some controlled substances. Now, of course, everything that's launched under Magi is uncontrolled and has the approval to be sold across a very rigorous safety profile that we have done ourselves. But the approach for how we come up with our dosages is very similar and inspired really by Shulgin, by some of the early Magi, and many of the earliest practitioners, which is really just self experimentation.
Mm-hmm.
Naturally, rather than synthesizing something novel, then taking it to try and see what it does to ourselves, which was Shulgin's approach here. Our approach has been more out of our lab using this extraction technology. What are some of these novel plants, or sometimes even non-novel plants that have been known for a long time, but when you start mixing their different alkaloids together, this receptor map, when you combine, for example, a beta-carboline with another well-known and just off-the-shelf compound, may give a very different subjective experience. And through our own approach of trying to map that subjective experience back to the receptors, back to the actual neurobiology, is how we've come up with the very specific dosing for our 4 different products.
Right. So this is how, so this also is another possible pathway to intellectual property and patentability. You've focused on polypharmacology. You're focused on proprietary formulations, combinations of these natural compounds, beta-carbolines and others. So, as a company, of course, you have to be concerned about, patentability and intellectual property. You have to produce value for your investors. But just in terms of the uses of these things, what I am hearing here, as you talk about the effects and the way they potentially might be used, it was either Freud or Jung. I think it was Freud. He said a lot of dumb things, but one thing he said was dreams are the royal road to the unconscious, and pointing to a clearly therapeutic role for dreams. And in many cultures, of course, put dreams at the top. What the shaman dreams, what the patient may dream if they're being treated by a shaman. So it seems like just these formulations may work in the context of therapy, not necessarily. And when you're psilocybin, like a psychedelic, where you take it once or twice, and all of a sudden, you don't smoke anymore, or something like that, a dramatic effect. But if people have situations where it needs more extensive psychotherapy to work out deep trauma around whatever. I mean, these kinds of mental, I wouldn't call them disorders, but mental dysfunctions in some ways, more call for extended psychotherapy. It's not something that's going to happen in 1 or 2 sessions. It takes time. But it seems very likely that these compounds could really facilitate that. And I think that would be very interesting. And I think that my guess is there are a number of therapists that would like to work with you on this to see if these therapies could be worked out. And for all I know, you already are working with some. But that would be a viable direction forward, I think. And
yeah, you're absolutely right, Dennis. I would stop not just at dreams, but the other key portion or the other key practice, which is beneficial not just for a therapeutic standpoint, but also for just the maintenance of a healthy psychological and mental state. Of course, is also just meditation.
Right. For meditation. Yeah. Well, so the compounds are the formulations and the compounds are very promising.
Yeah, something else I was just thinking about was you were speaking there is, back to early Tang Dynasty, there was a period in Chinese medicine where doctors, they were compensated as doctors in healthcare rather than in sickness care of what we're accustomed to, meaning that they were compensated when you were healthy and you stopped paying them when you were sick.
Right. That's how it should be. That's not a revenue model that's going to work in modern.
No, unfortunately not. But I was thinking about that as you were speaking because it's while there's certainly this beneficial element of helping to have a deeper level of vivid or lucid dreams to experience some of the emotional challenges in a safe space, or in addition to some of the insights that you can garner from meditation as a part of a therapeutic process, even as a proactive health process. That's really how we have originally started our formulations here, is for the conscious and the mindful community that are trying to better understand themselves and reach their own level of deeper insight about themselves, whether through meditation or the night version of meditation, which is dreaming.
Mm-hmm. I can imagine that these formulations could work well as an adjunct to the kind of work that Alexandre does, for example, with the sound immersion therapy and that sort of thing. I would think that they would fit together very compatibly with that. And if you come to New York, as you're going to, you can talk to him. He'd be willing to. He would be, I'm sure, willing to give it a try with some of the groups that he works with. So that's something to keep in mind. We can discuss it with him. Have you sent him any of these?
Oh, absolutely. Yeah, this is a good reminder. I need to ping him to get some feedback from him.
Yeah, you did send him some.
Yes. Yeah.
Okay, good. Well, now that I have a better picture of what to expect, I promise I'll do my homework, and by the time I see you in New York, I'll have some subjective impressions to share with you. So, looking forward to that.
Yeah, for the listeners here, I think the thing we haven't talked about here is actually what are our products and what are our current 4 products and what else that we're working on. So maybe we should spend a little time going to some of that.
Sure, let's talk about that.
The 2 most unique products that we have, the first one, which is actually, Shauheen, I think it would be helpful for you also to provide some of the actual cultural context behind their names, but is known as STARD, which is our meditation aid. This is one that is more of a mini dose than a microdose and has been formulated with a very select group of beta-carbolines here in a particular dosage and a ratio here, so that rather than the traditional approach to microdosing or mini dosing of helping with your productivity, I would say it actually does the opposite. It helps with your non-productivity. And why would that be useful? Well, that is particularly useful when you're trying to meditate and your own monkey brain is cycling through all these thoughts and anxieties. And this is exactly back to the original use of Haoma by the Magi here in using this in meditation before an open fire in order to maintain this open level of a mind.
Absolutely.
There's a lot to be said for non-productivity, for disengaging, but disengaging in a very deliberate and conscious way, in a certain way, because we are distracted. I think in our culture, more than ever, we're distracted by all the stimuli that come to us, particularly through the internet. It's great to shut off all the screens and look at the inner screen for a while and see what's going on there. So, okay, this sounds good. What about the next one?
Yeah. The last thing I want to say about that, I love exactly what you said there. I just finished reading Oliver Berkman's last book, 4,000 Weeks, where he talks a little bit about how in Aristotle and the Greeks, they actually saw leisure as the most divine pursuit of man. And it's because leisure is very different from how we define it today. It wasn't us sitting playing video games. It's actually really the pursuit of just nothingness for itself, of just discovering yourself. And he saw it as truly valid as opposed to activities such as work. What you're doing is goal-directed. Like leisure is there for the purpose of itself. It's autotelic. Mm-hmm. That is exactly the most rewarding part of why we actually undergo meditation.
Yes, it's ironic, isn't it? I mean, we work so hard in order to have more leisure time. And like we feel like we have this very peculiar relationship to work, and it's like, and when you just devote time to meditation or self-development or reflection, I mean, our culture's changing in a lot of ways. These things used to be devalued, and not valued, but now I think with the emergence of psychedelics, slowly our culture is beginning to recognize the value of inner states, basically, reflection, meditation, self-knowledge, self-development. So this is all a healthy thing, but it takes time to get accepted into a culture, especially one like ours, where the main drug is coffee. We're the coffee achievers. We like stimulants, and that's a reflection of the way that we relate to, our work and everything else. It's like if you're not focused, stimulated, you're not doing your job, But we need to evolve away from that. And when you're
Yeah. Well, John, do you want to go through Mang as well? And maybe I can...
Yeah, maybe just a quick intro, and then I want you, Shauheen, maybe it'd be helpful to talk a little bit about some of the cultural context. But the second most unique product we have is Mang, which is also a mini dose more than a micro dose. And this one, I'd say with a similar intention of a start, also meant for the unproductivity, but meant for the unproductivity for you to take before you go to sleep at night. And through some of our own studies of measuring brain waves in the state of what we would expect to occur during REM sleep, which is characterized by a higher level of high frequency gamma wavelengths. This is actually facilitated and improved through supplementation with the Mang formulation when you take it before you sleep at night. And the exact purpose of that is to help you have more vivid and especially lucid dreams when you're in your REM phase.
Okay. So these mini doses, formulated for mini doses, so these are doses that if I take it once, I'm going to notice something. Something will happen that's noticeable, right? As opposed to the microdose where is it happening? Isn't it happening? You can't really tell. You just sort of have faith that it's doing something. So you wouldn't recommend, or would you recommend combining these things? Is that a good idea? Or use them separately in series? Or how would you recommend that people use these?
Yeah, certainly separately. In series is okay as well. But if your objective is to actually feel something more than mini one, rather than combining a mini plus a micro, the simplest way is just take more than mini.
Right, take more of the mini. Okay. So tell me about the micro products.
Yeah, the two microdose formulations we have, one of them is actually named Haoma, and it's named Haoma specifically in reference to the actual use of reaching a deeper level of sleep. So that one is a deep sleep aid where we have formulated that with its level of alkaloids there, that rather than trying to increase the level of high frequency gamma wavelengths during sleep, it's actually trying to increase your lowest frequency, which is your delta wavelength when you're in a deep sleep stage. And that's meant more for the reparative nature of of what's happening with your brain's lymphatic system, to help clean out all the junk that's been accumulating during the day, and to help your organs to recover, rather than necessarily something that's more for psychological insight. It's really meant much more for physiological recovery.
Okay. And what about the other mini product?
And the last mini product is called Ameritats, and that is probably the most classic of a kind of a daily nutritional supplement. But rather than nutritional supplement for your body's health, it's much more for your brain's health. And this is really for getting a specific quantity of beta-carbolines into your own neurochemistry, given all of their well-researched and extensive length of neuroprotective, neurogenesis properties, from regulation of regulatory enzymes, inhibition of some of proteins that have been implicated into neurodegenerative disorders.
So this is your, for cognitive development or prevention of cognitive deficits. This is your anti-dementia formulation a certain way. Yeah, I better get started on that one right away. I can feel it coming on, so it's never too late.
We feel that too.
Well, with the mini products, the micro products, you have to take them for a while before you perceive a response, right? Whereas the mini products are pretty much, that's like a low dose, perceptible. But the micro products, I'd have to take it for a couple of weeks before I'd really notice much effect. Is that pretty much how it would work?
Yeah, that's exactly right.
Yeah. Okay.
Yeah, the mini products the mini products most people will feel in about 10 to 15 minutes, and then the duration of it will be 40 to 50 minutes.
And when you're okay.
Yeah.
That's by that time with the sleep products, hopefully you're asleep by then. So yeah. Well, this is fantastic. These are very interesting for all sorts of reasons.
Yeah, maybe I can quickly refer to what their name means, and some of them were very interesting. So I start with Mang. So Mang was a very strong psychoactive potion that basically was given by Zoroaster to the king of his time, Wishtas, they're saying that it was a combination of Haoma, which it could be whatever the botanical identity of Haoma was, plus Mang, which before 12th century, Mang in Iran was, black henbane. Basically, if we assume that, Haoma was beta-carbolines, so basically it's a combination of beta-carbolines, which were oneirophenic, plus, some dissociated, like atropine, or scopolamine products. So that's how it was, just like were putting, them, into like a long sleep. So, but the Mang that we have is nothing to do with that strong potion, but that's where the inspiration of the name comes from. And the start is actually the definition in Pahlavi language of a state of mind, which this is it means that like to spread out to something larger, to spread out, to a broader consciousness. And that's why we kind of like named our meditation supplement Start, which, this kind of like evokes this state. And the Ameritat in Avestan language means immortality, which is our microdose for neurogenesis and neuroprotection. And Haoma, as John explained, is more like a unique product, that is around, the quality of deep sleep, and the way that we developed that, it was just like mostly doing a lot of work around sleep tracking, and brainwave, tracking, and then kind of like more of, working on data, to get into formulate these. But something that is very interesting around Magi, which we like to also just put out with these supplement is that is not we don't want them to be only a supplement, but like a supplement and practice. So we want to let's say develop this practice of meditation for our consumer, or develop the practice of like going after finding their own blind spots, or anything that they want their life to thrive on through the meditation, or let's say lucid dreaming. And With that, for example, there are two psychedelic actually conferences that are coming. One is the MAP Science Conference that you're going to be hopefully there as well, in Denver in June, as well as another conference by Psychedelics Today at the end of March that we host this group meditation that are supplemented by our start. And we are hopeful to just kind of like use that as a tool to kind of like build community around these mindfulness practices.
Right. And that does seem like a great application. That's really, I think, what I had in mind when I referred to the way they might fit into therapy. I mean, it's not that they would necessarily fit into therapeutic regimens like we think of that, but into meditation practices. So meditation is something that has to really be learned in order to integrate it into your life. And it seems like these products might be very appealing to people that teach mindfulness meditation and that sort of thing. I have just the person who would be happy to help you with this, but we'll leave that offline and I'll get back to you. But there's a gentleman I know who's taught mindfulness meditation for many years. He's a good friend of mine, and he would be, I'm sure, happy to work with these. And when you're
Great. Awesome.
Yeah. So, this is, and also, I wanted to ask you, so does the Magi website, you have a website, or is it just VCENNA? You have a special website where people can learn about these projects, like magi.com or something like that?
Yeah, should have put this on the background there. It's actually ancestralmagi.com is the name of our shop where people can go online.
Magi. And when you're okay, so people can learn about these products off that website. Okay.
Yeah, we have a fairly robust knowledge base on the product pages as well as our blog, which we continually populate with some of our own new discoveries. And this is what's next for us, and what we're also most excited about is we've released our first few products based on Beta-Carbolines, and we've got a number of other products that are coming on the way that are really also just based on exactly what we've talked about here, some polypharmacology, using all legal products. Always will be a supplement that's available off the shelf and can be purchased and used in your own daily practices. And some of them are combining beta-carbolines with other just conventional fruits and plants that have been well known, but can provide some very unique properties when combined together.
Right. And when you're in medicine, there's often a fine line that there's often not that much different. They complement each other. Who was it? Dioscorides who said, "Let your food be your medicine."
Yeah.
Right. And all right. Well, gentlemen, thank you very much. This has been a very interesting conversation.
Absolutely. It was our pleasure. And thanks for giving us this opportunity. And again, in the first place, with ESPD 55 to inspire both of us to dig deeper into our ancient histories and like kind of bring these up. So it's an ongoing journey, and like it has no end.
Absolutely. Well, we look forward to the next ESPD conference. I don't know whether it'll be ESPD 60, probably sooner than that, maybe ESPD 57.5 or something, but certainly look forward to your discoveries that you're in process of making, and we'll be happy to invite you back to the podcast downstream, and we'll see you pretty soon in New York, hopefully. So thanks a lot.
Thanks a lot.
Great. Thanks, Dennis.